So I think I'll get going. I'm Dr. Melinda Ring, and the director of Northwestern's Osher Center for Integrative Medicine. And I'm honored to be presenting or sharing with you one of my friends and colleagues, Dr. Peter Wayne, for this Grand Rounds that is co-hosted by IPHAM and the Osher Center. We have a series of these coming up, so please check those out too, from some of the other directors of the other Osher centers. So to introduce, Dr. Wayne is the Bernard Osher Associate Professor of Medicine in the field of Complementary and Integrative Medical Therapies at Harvard Medical School, and he is director for the Osher Center for Integrative Medicine, which is jointly based at Harvard Medical School and Brigham and Women's Hospital. The primary focus of Dr. Wayne's research is evaluating how complementary and integrative therapies clinically impact aging and chronic health conditions, and understanding the physiologic and psychological mechanisms underlying observed therapeutic effects. Dr. Wayne has more than 40 years of training experience in Tai Chi and Qigong, and he's an internationally recognized teacher of these practices. We've had the pleasure of hearing Dr. Wayne speak several years ago at our MindBody Medicine community event and research day, and I'm thrilled to hear what's new in the world of Dr. Wayne. We will answer questions at the end, so please enter them in the Q&A. And with whatever time is left, I will bring the questions to Dr. Wayne to answer at the end. We won't be monitoring the chat for questions. And with that, I will let you take it away.
Well, thank you, Dr. Ring, for the kind introduction. I'm truly grateful for the opportunity today to share some ideas and research findings related to Tai Chi and whole person health and healthy aging. Of course, I wish I could have participated in this event in person and been able to visit with you and other Northwestern colleagues and friends, but I'm glad that we can leverage this platform and stay virtually connected during these unusual times. Before beginning, I'm required to disclose that in addition to being a mind-body researcher, I oversee a community-based Tai Chi school in the Boston area. So my guess is most of you already know that beginning in the 17th century, but especially in the past 150 or so years, medicine has been greatly influenced by reductionism. That is a way of seeing the world which believes that complex phenomena, including health, can be best explained by analyzing increasingly simpler components or building blocks or mechanistic processes that are associated with a system. Reductionism has supported the evolution of medical specialization and organ-based medicine, which of course, for those who become seriously ill or in need of the expertise of a cardiologist or an oncologist or a neurologist, we are really, really grateful for. In more recent years, reductionism has drilled even deeper and led to great insights into subcellular, genetic, and molecular levels, leading to remarkable breakthroughs in precision therapies for cancer, cystic fibrosis, and lots of other conditions. However, it's also my guess that most people listening today also appreciate that there are costs or side effects to reductionism and specialization in medicine, namely the fragmentation of individuals and the way they're cared for into disconnected parts and processes with less appreciation for the whole person. To use an ecological metaphor, sometimes reductionist medicine sometimes doesn't see the forest for the trees. At our Osher Center, and I think across the Osher Collaborative and more widely in the growing integrative medicine community, integrative medicine is no longer thought of as simply co-locating an acupuncturist in a pain clinic or a mind-body program in a stress reduction clinic. Rather, integrative medicine is seen as treating the whole person and enhancing the interconnections between their components. From a more holistic or systems biology or even an ecological perspective, health is believed to emerge from the healthy crosstalk and complex dynamical interactions between physiological systems. And fortunately, an appreciation for this way of viewing viewing and studying whole person health is now front and center at the National Center for Complementary and Integrative Health at NIH, whose new strategic plan, which I highly recommend if you haven't read that, emphasizes this whole person ecological approach. Key themes in this plan that I think are relevant to my talk today include that analysis, or the reductionist taking things apart, and the systems or synthesis approach of putting things back together are not antagonistic. They're actually complementary, and together, synergistically, they create greater insights into health and healing. That the focus on synthesis, or putting things back together, or sometimes we jokingly say putting Humpty Dumpty back together again, has received a lot less attention. And this is going to require us to do research looking at how different components or organ systems interact, the physiological crosstalk between these systems and what we sometimes call the mind and the body. And with that being said, this agenda offers a particularly unique role for studying multimodal mind-body therapies like Tai Chi, for maintaining and restoring health, and for understanding how interacting components underlie whole person health and healing. So with that context, what I'd like to do in the next 30 minutes or so is introduce Tai Chi as a multi-component mind-body integrative therapy, which I think has evolved to ecologically target different systems in the body and put them together so that the emergence of health happens. I'll give you a broad sort of 5,000-foot overview of the evidence for Tai Chi. You might be quite surprised at how much research has been done in this area. Talk a little bit about prevention, but also highlight how little we know about it. But I'll show you one epidemiological study related to all-cause mortality. And then I'll focus most of my talk on looking at how Tai Chi impacts issues of great relevance to our aging society, falls and cognition and chronic pain, and how the multimodal nature of Tai Chi may afford unique advantages in addressing these issues. So it's always good to just bring everybody in for those who don't know much about Tai Chi, but we use this definition, which is that it's a mind-body exercise. We know it's rooted in a number of Asian traditions, including the martial arts, traditional medicine, and philosophy. The training integrates slow, intentional movement with breathing, and importantly, a number of different cognitive skills, heightened body awareness, attention, imagery, visualization. And together, these training principles aim to strengthen, to relax, and to integrate the body and the mind, improve health, personal awareness and self-development, and in some cases, Tai Chi is practiced still as a highly effective martial art. This diagram gives you a sense of the richness of this multimodal intervention. There's not a lot of time to unpack these things, but up here we see that Tai Chi is like a physical exercise. It's moderately aerobic. There's a lot of weight bearings, there's musculoskeletal work and strength training and flexibility training. We're also interested not just in how the biceps or the hamstrings develop, but how the whole system biomechanically and structurally integrates. So that's an important training component. There are lots of cognitive pieces, relaxation, mind body. You can think of all these components being like mindfulness on wheels, these sort of meditative components integrated in an embodied way. Lots of use of visualization, imagery, and we know from good research in placebo that what we think affects how we feel. And so that's an important piece that's been built in over the evolution of these practices. Breathing's a big part. We know this is a huge part to health. Being in groups, we know increasingly is such an important therapeutic component. And there's even embedded philosophy, like maybe don't go 100%, maybe 70% is enough, less can be more, go with the flow. And so in these practices, you have these therapeutically relevant behavioral strategies. This diagram shows you how this multi-component, like a multi-non-drug intervention, impacts one of the things we'll be talking about, which is falling. These are risk factors for fall here on the right. And again, I've just briefly mentioned some of these, but each of these have been shown with good randomized trials to benefit from Tai Chi. And what we see is that Tai Chi changes lower extremity strength. That weakness makes you more likely to fall. Deficits in plantar sensation and proprioception that happen with aging or neuropathy. Coordination that goes down with aging or neurological conditions, anxiety, all of these have been shown to change. So the key take-home message that I think goes back to the systems biology framework is that unlike a drug, which is like a single agent that targets a single receptor in the body and affects change from there, these multimodal interventions, mind-body practices, are like multiple ingredients that hit multiple receptors in the system and then affect change in a much more ecological or systems-oriented way. This is why we think they're effective, but they're also really challenging to study in a traditional cause and effect kind of way. There's quite a bit of research being done. This is a new meta-analysis of bibliometric analysis that my colleagues and I just published. And this is looking at the data from the last 10 or so years. It was a follow-up to another one we did prior to that. But to date, there's probably 1,500 peer-reviewed scientific articles just on Tai Chi alone. This next piece that was in this publication shows that over time, in the last 10 years at least, the proportion of these studies that are randomized controlled trials has gone up. And we know that the quality and rigor of these trials generally are much greater than observational or epidemiological studies. But there's still a lot of variability in the quality of studies, but evidence is growing and many new studies, and I'll share some of those, are being published in very high impact journals. This gives you a sense of where attention has been put in the Tai Chi community, and you'll see it's focused a lot on older adults, and there are deficits in knowing the value to middle-aged adults and young adults and even children. But each of these categories that has an asterisk means that there's not only been a systematic review, but meta-analyses or systematic, not only a randomized trial, but meta-analyses or systematic reviews pooling those data that are shown to be positive. So balance, and we'll talk about that. I won't say much today about some work in heart failure that we're doing and others, hypertension, other cardiovascular risks, COPD, other respiratory issues as well. I'll say a little bit about some pain research, but that area is just beginning to grow quite a bit in Parkinson's and stroke. Seems to be some benefits, particularly towards mobility, and a little bit of evidence growing in affect in terms of depression and mood, but not as much as we would imagine. Some growing evidence in cognitive function. I'll say some work over, say some things about that in my talk. A nice pool of evidence growing in terms of managing the symptoms of cancer, and also some new recent studies, so very supportive of sleep quality. One important part of evidence, I believe, for all of us is it's safe. And we did a systematic review recently. There's another one that's updated this, but it's not too different in its conclusion. But by and large, and this was looking at the time we did this, 152 trials, including people who were quite frail and ill. Some were heart failure patients waiting for heart transplants. We found that there were no serious adverse events reported across these trials. But it's important to note that the quality of reporting in these studies was very low. And this is not limited to Tai Chi or even integrative medicine. Non-pharmacological trials are notoriously known for not having good reporting of adverse events. So, but in the cases where there was good data, we're pretty confident that it's not likely to result in anything severe, but like any exercise, there's no free lunch. People get sore, there's muscle aches and pains, and those need to be considered. So there's not a lot on prevention, even though this is a huge part of the traditional integrative medicine and Chinese medicine. This is a quote that I really like from the Yellow Emperor's classic, even in 300 BC, talking about prevention. They said, to fight a disease after it has occurred is like trying to dig a well when one is thirsty, or forging a weapon once a war has begun. So we know that working upstream to prevent people from getting seriously ill or even a little ill is really important. But the data on this is really limited. This is the one study I think illustrates the potential for this. This is a study, an epidemiological study that's ongoing. It's called the Shanghai Men's Health Study. It's paralleled by the Women's Health Study. It's administratively based at Vanderbilt in the US. And one of our colleagues, who's now the new leader at Vanderbilt, Gurjeet Birdie, had the idea for this study. And what they looked at was about what they knew when they looked at the exercise data in this cohort, which is close to 60,000 people. was that about a third of them practiced Tai Chi or some similar exercise of thought, a third did walking or jogging, and a third was sedentary. And what they could look at was all-cause mortality and break it up into cancer and cardiovascular disease. And the basic conclusion here is that over a period of, I think, 7 years of observation, this hasn't been updated, compared to being sedentary, Tai Chi practice is associated with about a 21 to 24% reduction in mortality risk. And for cardiovascular disease, if you do Tai Chi and you walk, there's a 45% reduction. Again, this is epidemiological and it's based on association, not necessarily causal, but it is provocative. And I think that there are lots of epidemiological studies that are ongoing that could be piggybacked to ask similar questions. So what I'd like to do now is talk a little bit about this idea of top-down, bottom-up interactions and looking at how Tai Chi is important for two significant public health issues, balance and cognition. Most of you know that about a third of the adults over the age of 65 fall each year. And this is a really significant public health issue. Not only do these people suffer serious injuries and morbidities, 1/5 of the people who fall and have a fracture will die because of the sequelae, and the costs that are associated with falls in 2015 were estimated to be 32 billion. And because of growing populations, it's up to about close to 55 billion now. And it's expected to continue to rise. The epidemiology of dementia and cognitive impairment is even more alarming and quite scary. The latest data I've seen suggests that over 10 million people over the age of 65 have early stages or what's called mild cognitive impairment. 6.2 million have formal diagnoses of Alzheimer's, and 11% or so have any kind of form of dementia. This is epidemic, and the costs are staggering. In 2021, estimated cost for caring for people with dementia was over $350 billion. And the approaches that our conventional care system have been using to treat balance and cognition, at least in prior years, has not been very integrated. So if you've got some issues with balance, you go to maybe a physiatrist or a physical therapist, and they'll give you some strength training, flexibility, maybe some stamina, agility training. But if you have cognitive issues, then you might want to do some cognitive training, some social activities, learn languages, do Sudoku puzzles. And we're still looking for pills or pharmacological approaches for cognition and preventing dementia. And sadly, a lot of the recent trials just have not panned out. And there's certainly not a good pill you can take to prevent falls. So there's a real look to non-pharmacological approaches for this. What we're learning from good research is that thinking about cognition and thinking about motor function shouldn't be done separately. And the short take-home message here is that how you move greatly affects how you think in your cognition, and how you think also affects how you move in your risks of falls. And I'll unpack that a little bit. So most of you know what executive function is, but it's that part of cognitive function that is at the higher end of the hierarchy. It organizes task shifting, goal setting, planning, those sorts of things, like the executive at a corporation. And what meta-analyses of large numbers of cohort studies have shown is that people who have intact memory, largely intact cognitive function, no dementia, but even modest deficits in executive function are 44% likely to fall than those who have normal executive function. So your ability to shift tasks and notice what's going on and plan is obviously relevant to your postural control. What is even more intriguing to me is that the converse is true. And let me walk you through this plot a little bit. This is a survivorship curve. This is over 12 years, and it's an epidemiological study of about 27,000 people. These are people who are seen in primary care and asked two very simple questions. Do you have any cognitive complaints? Where you left your keys, memories, names, all sorts of things like that. It's just a yes or no. It's not a significant test. And then they're also asked to walk a distance and their time. Then they can look at the speed that they're walking relative to normative data. And what you see is over 12 years, these are all people who I think are 70 years or older. They have no signs of dementia at the beginning, so they're dementia-free. Over time, many of them develop dementia, as the epidemiology data I showed before indicates. The people who had no cognitive complaints and walked at normative speeds had the lowest risk, but still you can see it's about, to 30% risk of dementia. It's quite scary, 1 out of 3. Those who had cognitive complaints, not surprisingly, had a higher risk, about 8 or 10% greater. What's interesting is those with no cognitive complaints, but who move slower, actually were at greater risk of developing dementia. So movement is a better predictor of cognitive decline than is baseline cognitive function. And people with both had the worst prognosis. So how you move affects how you think in the long run. So this is making people think, should we send people to a separate person for balance and a separate person for cognitive function? And no, it's saying, let's think about how we can train people in multimodal ways. So maybe we don't just do aerobic exercise and cognitive function, but we have people do Sudoku puzzles while they're on a treadmill. And the reality is that's what's happening. There's dual task training that's being developed. You can see this older gentleman here who's doing some balance and strength training while he's doing a cognitive task. Those of us who had children or remember playing these gamification systems, this is Dance Dance Revolution. There are some tools like that where you have to move in ways in response to cognitive cues. And then there's even virtual reality where you have to navigate different obstacles and use your planning along with your balance. So those are modern approaches, but there's also old school approaches. And this is where Tai Chi comes in because we know it's targeting both cognitive and motor processes at the same time. And so I'm going to briefly say a few things about its impact on falls, a place where affect and falls come together, which is the anxiety about falling, where thinking and moving come together, and cognitive motor actions, and a little bit about cognitive function as well. So tend to be conservative in my conclusions, but I would feel very comfortable saying Tai Chi is one of the best tools we have right now for preventing falls in older adults. Somewhat dated Cochrane review suggested it's about a 30% reduction in falls, and it was pretty much as good as anything that was available at the time. More recent meta-analyses suggest about a 20 to 43% reduction in fall risk, and this has been replicated in unique populations such as people with Parkinson's disease, stroke, and other conditions. So good evidence from lots of trials for falls. Here's one of them. This is a recent study that was published in JAMA Internal Medicine in 2018 by Fuzhong Li's group out in Oregon. And this is a 3-arm trial comparing Tai Chi Chuan or Tai Chi to a multimodal exercise that included strength and aerobic and resistance training, and comparing it to a seated stretching exercise. This is the control. It was 6 months of training, a robust sample size, so fully powered. And what they basically found was after 6 months, using hazard ratios, there's about a 58% reduction of risk of falls when you compared Tai Chi to stretching. And when you compared Tai Chi to even this multimodal exercise that did not emphasize more of the cognitive pieces, there was still a 31% reduction. What was also important was that 12 months out, so there's good follow-up, there was a 75% reduction in serious injurious falls. And those are the ones that really drive healthcare costs. So this is robust data. What's also really remarkable about this line of work by Fuzhong Li is he's done some implementation research, and he's taken this protocol, this very specific protocol called Tai Chi for Balance or for Better Balance, and he's brought it into 35 senior citizen centers in Oregon with a sample of approximately 511 people. He implemented this over 48 weeks. There was good adaptation. People completed the program. And at the end, they saw very similar results to the clinical trial, about a 49% reduction in falls. So not only does this work in a controlled laboratory setting, but it seems to translate well into the community. So now I want to shift to this idea of what's under the hood. Why is Tai Chi so effective? And I want to start with cognitive or affective interactions with falls. And there's a really vicious cycle between people who've had a fall, they start to develop anxiety around fall. I think the statistics is half the people who've had a fall develop formal anxiety-related fear of falling. And some people who haven't fallen but are older also have this. And the problem is that it's a vicious cycle. You develop this fear of falling. It results in you doing less physical activity. You don't work out as much. You might not go to the supermarket. You might not socialize. That reduced mobility reduces your fitness. It also reduces your confidence, makes you more likely to fall. And it's really hard to break this behavioral cycle. Okay? So fear of falling is actually one of the better predictors of a future fall. And what we've learned is that Tai Chi in part affects falls by changing this construct. There's good psychometrically sound measures of fear of falling. Meta-analyses suggest about a 35% reduction in fear of falling amongst those exposed to Tai Chi versus controls. And then more generally, what we're seeing is that this sort of gentle mind-body gradual approach to being physical, more embodied way, is associated with overall self-efficacy. People tend to do other exercises well, walk. And so we're starting to call it a gateway exercise. It's a way to bring people back in to rehabilitate safely. So a little bit on cognitive function. I won't spend much time on this. We did a systematic review in 2014. We found 11 trials, and we found good preliminary support that Tai Chi can positively impact executive function, especially, but it also could help with global cognitive function in adults with mild cognitive impairment. There's been some recent updates to this, but by and large, the conclusions are still the same. No really large-scale definitive trials yet, but compelling evidence. Here's one of the examples done by Mortimer and colleagues. I think this was based in Shanghai, and it was a randomized trial with 120 people, average age of 68, all quite intact in terms of mini mental exam, in terms of mental cognitive function. 4 groups: Tai Chi, aerobic walking, social interactions, and usual care control. Another nice long-term study, 40 weeks with a good dose of Tai Chi 3 times per week. And what they found was an overall dementia index. A higher score means you have better cognition overall. Tai Chi, the change in that was greatest in Tai Chi. There was also some change in the social support, and that the Tai Chi outperformed all of these, especially the walking and non-intervention. There are lots of good studies that suggest that walking is very good for cognitive function. So this is just this study. Also, you see improvements in executive function. This is the time it takes to complete a task, the trail making test. Faster is better, so lower numbers. And what they found even in this study, it's a dated study, was that total brain volume changed in these 40 weeks, which is quite remarkable. There's a growing number of studies that are looking at cognition using neuroimaging techniques. And by and large, what these studies are showing, not nearly as many studies as there are in meditation or acupuncture, for example, because it's hard to capture what's going on in Tai Chi in a static scanning sort of system. But there are some plastic changes in certain regions of the brain and networks of the brain that are associated with cognition. And there's some studies that have shown that improvements in cognition manifest in very objective biological markers in the brain. And this was just an interesting study I saw. I think this is done in Lithuania just this year, and it was done during COVID, which I think was interesting, and everyone's stress is amped up at this time. And we know stress is, basically rots your brain through cortisol and other mechanisms. And what they found in this very small study is just after 12 weeks, this marker, brain-derived neurotropic factors, which we know is important for synaptic connectivity and neurogenesis, was actually improved after Tai Chi compared to the control group. So there's something biologically happening there, and I think a lot of promise in there, especially since we don't have many other solutions for the epidemic of dementia. So now what I want to talk about, going back to this whole idea of whole person health and top-down, bottom-up interactions is how these cognitive motor interactions might be influencing both cognition and falls. And one way that we can do this in the laboratory is to look at what we call a dual task cost. We know that when you're distracted, that you don't move as well. And the simplest example is this: we know that if you're on your cell phone, you don't drive as well. It's dangerous. People on cell phones in New York subways, don't see where they're going. Some of them fall on the tracks. Well, we know that even having a heated conversation or looking at a grocery list or up on the shelves change how you move. And we can measure this in the laboratory. This is an actual participant in our study walking in one of our systems. She's walking at the top quietly. She's not being asked to do anything. On the bottom, she's walking and being asked to count backwards by threes. And what you'll see is two things. One, in the top panel, she's walking faster. You'll see this as she turns the bend in the bottom panel. But while she's counting, not only does she walk slower down here, but you can see the regularity in the steps is much greater up here than the stride time regularity or variability down here. Okay, so it's much more variable and slower. And what we want to know is, will Tai Chi allow this woman to walk more like this even when she's doing a demanding task? And this is where the rubber literally hits the road. People fall when they're out in the world, engaging, having conversations, navigating. So we want to improve their function in the real world. And so that's what we wanted to do. And this is what we do experimentally in the laboratory. And what we found is that this is a study done by one of our postdocs who's now an associate professor at Harvard, Brad Manner. And it's a small study, 60 people comparing Tai Chi to an educational group, time matched, not spring chickens here. The average age was 85 years old. Number of people turned 100 in the study. So it's never too late to learn Tai Chi. And what we found was the speed of walking while you're doing a dual task was improved in Tai Chi. So there's some functional improvement even with this cognitive challenge. So Tai Chi is helping that toggle between the two. We've also done some studies in more healthy older adults. This is a study we did with people who are between 50 and 80. In this case, we're comparing 30 Tai Chi experts from the Boston area. These experts on average had 25 years of Tai Chi experience. If Tai Chi is going to have any benefit, we better see it in this group. We compared those to 60 Tai Chi naive, very, very healthy people because we did a lot of studies on measures on autonomic physiology, so they were not able to take meds. So this is super healthy people who are already physically active. And this is looking at the variability. More variability is more of a stutter in your step, less cadence or regularity. So higher variability is bad, lower is good. And what we see is these experts have lower stride time variability while they're asked to do cognitive tasks and walk. We can then take this group of people here, these naive adults, and randomly assign them for 6 months to Tai Chi. And what we see there is that they start to move in the right direction. Those that get short-term training start to move in the direction in terms of more smooth rhythmicity of gait compared to Tai Chi, people who didn't get any Tai Chi. And we've seen this in Parkinson's. It's really important in Parkinson's because we know that due to dopamine loss, volitional movement, regularity in movement is limited over time. But there's some theories that using other parts of the brain, like regions that are code for executive function, like the prefrontal cortex, might be able to override or compensate for that. And we think that that's one of the ways that Tai Chi helps with Parkinson's. It's a really good set of studies published in New England Journal of Medicine showing that Tai Chi reduces falls and improves a lot of function in people with Parkinson's. And we think part of the mechanism is their ability to toggle during a dual task, that mind-body connection. So again, whole person looking at the emergence of behavior patterns by looking at interactions between different components. So I want to just really briefly say a few things about this interaction in the context of pain. And there's not nearly as much research in Tai Chi and pain as there is in mobility and other areas, but it's starting to grow and it's showing the same pattern. Pain's really important. I think everyone knows that. About 31% of the people over the age of 65, have chronic pain. The older you get, the more likely you'll have this. And the price tag for chronic pain in our society, just in terms of dollars, is somewhere between 560 and 650 billion dollars. And that's not even talking about the price tag associated with the opioid epidemic and other byproducts of our pain epidemic. So pain's really important, and we need alternative strategies. I'm going to say a little bit about 3 different areas where I think, again, the unique potential of Tai Chi is demonstrated by not just doing bottom-up things, but bottom-up and top-down at the same time, cross-system talk. This is a study done by Chen Wang here in the Boston area at the New England Medical Center and Tufts University. And it was a non-superiority trial. In other words, she wanted to know whether Tai Chi was as effective as the gold standard in treating knee osteoarthritis. And the gold standard is physical therapy. And what she found in this robust study, published in Annals of Internal Medicine, was that this is the pain score of WOMAC that Tai Chi was equivalent to, was not inferior, did not fail to be equivalent to physical therapy. In fact, there's some slight trends that it might even be better in reducing pain. Similarly with overall function score and the assessment of the global assessment. This is quality of life kind of measure. So Tai Chi is as good as what's out there, so it's an alternative. But what I think is unique is that Tai Chi also reduced depression, and there's often comorbidity between chronic pain and lack of ability to participate in various events and depression, but only Tai Chi and not physical therapy improve depression. So you're hitting multiple parts of the system, and in the long run, these changes in affect may also feed back on function and quality of life. This is another small study done by Amanda Hall. She was, I think at the time, in Australia. And her first study, which was published in 2011 down here, showed that Tai Chi reduced both the bothersomeness of pain and the disability of pain related to back pain. It's one of the few studies of Tai Chi for chronic back pain. It's an area that really warrants a lot more study. But she also had the wherewithal, she and her team, to look at potential behavioral and cognitive mediators. And in a later study, this one published in 2016, she showed that reductions in disability and pain were not only due to strength and flexibility, things you would think of would happen in Tai Chi, but that 1/3 of the reduction in pain and bothersome of pain was highly explained by this psychological thing called catastrophizing and also rumination. So people who have pain worry about it a lot, and Tai Chi is not only affecting mobility, strength, but also how you appraise that. Big part of, I think, some of the work that's going on at Osher Northwest by Melinda Ring's team. So one last study, I want to just say something about pain here, is a very small study that was done by one of my students in persistent post-surgical pain or post-mastectomy pain. It's a horrible multimodal complex suite of symptoms that follows this. So these are women who are diagnosed with breast cancer, which itself is traumatic. They choose to go through chemotherapy and radiation, usually both. They also have surgical procedures, either unilateral, bilateral mastectomy or lumpectomies. And they come out of this not only with the trauma of these very invasive procedures and having their self-image altered with these surgical procedures, but they also come out with chronic pain. Somewhere between 25 and 40% of these women have chronic pain, which in itself is really disturbing, but it also keeps them in that mode. Is this still the cancer? And it reminds them of all of the other sequelae. So we thought this is a really good model. This population needs some tools, and we thought it's also a good model to study how a multimodal intervention like Tai Chi or Qigong in this case affects this multi-component complex suite of negative symptoms associated with cancer survivorship. We're also interested in some posture and motion analysis to look at the relationship between posture and affect. And in summary, really briefly, we sort of hit a home run. This is an uncontrolled study, about 25 people, so it's a small study, but very provocative results. We changed pain in this period of time. We changed pain interference, anxiety, depression. This is called the Maya scale. It's a measure of interoceptive awareness. And it's a really beautiful instrument developed by one of our colleagues at Osher UCSF, Wolf Malin. And it basically asks questions like, for example, there are 8 constructs. One of them is related to the body. When I'm upset, I take time to explore how my body feels. In other words, you can feel the emotion in an embodied way. It's not just something in your head, but you start to notice this. So it's an interoceptive thing. And another one is around trust. And one of the things you would endorse is, I feel my body's a safe place. And these women changed their sense of embodiment and interoception dramatically across all 8 scales. And you'll see that in some of their qualitative statements in a minute. But I also wanted to say that we can bring people into the laboratory, which we did, really interested in movement and affect and movement and cognition. And we can give very precise measures of how they stand, how they move using infrared sensors. And we can measure angles. In this case, we're looking at whether the head is tipped forward, that sort of slumped shape, or whether it's comfortable up on top. And what we saw was that there was a change in the angle of the head from being slumped forward to the top, and that the magnitude of that change was correlated with changes in depression. We're not saying that changes in depression change how your head goes. And we're not saying how your head goes changes depression. What we're trying to use this data to say is it's silly to think of these as separate, that emotion is embodied. This is a paper that's currently under review. I just want to echo some of those thoughts, but also this mind-body connection and whole person perspective that participants in our trial were just so articulate about. These women were incredible. I'll just read a few quotes. I was able to, and this is following 8 weeks of this Qigong training in this population. I was able to pay more attention to my body. I'm trying to pay attention to where it hurts, realizing that when you get stressed, your body can reflect that. It's trying to tell you something. It's body wisdom. If something comes up that's stressful, I can actually feel my pulse accelerating, my breathing. I can then settle myself internally. The value of seeing the connection between physical symptoms and emotional symptoms and how to self-regulate. And these women talked about the mind-body connection. And many of them felt in those beautiful narratives, because we talked to them at baseline and at follow-up. So we knew their illness narrative and had a sense of what they were looking for and then how they changed. And many of them talked about their bodies violating them, that sort of they no longer had trust in their body at baseline. And so one woman wrote, how you feel about your body is a challenge after you've had breast cancer. But mind and body have to be interconnected, all of it together in what we call Qigong mind-body exercise. It relaxes you and helps you stretch out a bit, calm you down, help you think about your body in a different way, and to trust your body, to get inside yourself in a different way. It doesn't mean you're not going to get cancer again, but it could mean that you're more at peace with your own body. And if these data don't convince you about these connections, we'll go to another source. This is Schultz's Peanut, and I love this cartoon. This is Charlie Brown saying, this is my depressed stance. When you're depressed, it makes a lot of difference how you stand. The worst thing you can do is straighten up and hold your head high, because then you start to feel better. If you're going to get any joy out of being depressed, you've got to stand like this. So I think that's good evidence of the mind-body connection and thinking of things holistically. So to pull it all together, I think I'm confident in saying that Tai Chi is a promising intervention for enhancing a number of domains of health, including balance, cognition, and chronic pain that we touched on today. There's many others. The multi-component nature of mind-body training in Tai Chi may afford unique advantages over unimodal therapies like physical therapy in addressing whole person health. And that balance, cognition, affect, and pain are all interdependent. And this interdependence supports the value of looking at things in a more systems-based framework for studying aging and for studying the use of mind-body therapies to inform the interdependence, to decouple these, to understand these processes and how they lead to health and healing. And if we understand those mechanisms a little bit more, again, the analysis, we'll be able to maybe retool some of these interventions to put people back together, the synthesis in a better way. So the work I've shared with you today is done by lots of different people. I am a small part of a lot of the studies that I showed from my group, and there's no time to acknowledge them all, but I'm really grateful to a lot of my colleagues, mentors, and students. Thankful to NCCIH for their support for some of the trials that we presented today, and thank you for listening.
Thank you so much, Dr. Wayne. Always a pleasure to hear all of the wisdom you have. And we have a few questions that came up. Do you want to, you could probably unshare, well, I guess I don't think there's anywhere you're going to have to go back, so you could probably unshare your screen. So the first one came up when you were talking really about, it was earlier on, but I think it applies to the concept in general. And that is that there are many types of Tai Chi, and including the length of practice. And so, for example, in the meta-analyses or in these things that are comparing, you know, different types of interventions, how often is it the same protocol of Tai Chi versus different brands of Tai Chi, and are there differences in different types of Tai Chi?
Yeah, it's a great question, and it's a challenging one. So when we study a drug like an aspirin or an SSRI, we can replicate it with precision. You can do it in a factory in Germany and in South America, and you know what you're studying. It's a single piece and it's quite consistent. But as the question implies, there's a lot of heterogeneity. So Tai Chi, like in yoga, has different flavors or styles. There's flow yoga, hatha yoga, vinyasa yoga, kundalini yoga. There are similar styles in Tai Chi, yang style, wu style. And within those styles, there are lots of different protocols and different forms. And then teachers themselves are unique. And some teachers, you know, are really attractive to an individual and some aren't. So that connection is important. So there's a lot of heterogeneity. There's a joke in Tai Chi, you know, how many Tai Chi players does it take to change a light bulb? 100, one to change the bulb and the other 99 to say, we don't do it that way in our style. But that being said, there's a couple of things that are important that give me confidence in some of these meta-analyses. One, that we see this effect size across all the heterogeneity when we pool these studies means that there's something that's not unique to an individual study. Some studies, lines of studies have used a similar protocol. So the Fuzhong Li work has been, you know, developed a very specific protocol. We've developed a specific protocol. And not only do we have, you know, sort of good standard operating procedures to deliver that, we have mechanisms to observe classes to make sure there's fidelity in how it's delivered. So within a study, we feel fairly confident. And if we do across study comparisons, we feel confident in those comparisons. But there's also pragmatic approaches. And so one of the studies we did, which I didn't share, was looking at women with osteopenia or thinning bones and fall risk. And what we did is, instead of recruiting them and exposing them to our particular protocol, or the Chen protocol or Sun protocol, we randomized them to be able to choose which school in the Boston area was most convenient for them to go to. And their comparison group was a group of women who were not exposed. And so this is a pragmatic approach. And what it says, what it affords is generalizability. Within the same study, women who are selected in the control group and the Tai Chi group that are measured by the same people the same way, if we see an effect that's independent of the school, we feel comfortable generalizing this to other cities, cosmopolitan areas where there are lots of different areas. You can't infer that they got better because of this part of the protocol, but there's some advantages there. But it's a really big issue in meditation and in any non-pharmacological intervention. So great question, hard to answer definitively.
Yeah, thank you. So question that, or a couple I'm going to try to bundle together. One is, So, you know, and I know you did this in the pandemic, but what about online Tai Chi, virtual Tai Chi? Is there any evidence that these are as effective? And, you know, and then sort of, again, just to the kind of practice, is there a recommended dose of Tai Chi? So really a little more of the practical stuff about recommending it right now.
Yeah, so starting with the virtual question, it's a really good one. I think some of the teachers, just one generation ago, couldn't imagine what's happening. There's sometimes where we're leading our community-based classes, there's 150 people, doing Tai Chi virtually on a screen. And so it's just hard to fathom that this could happen in the evolution of these practices. And what we're learning in our studies, we actually have, prior to the pandemic, we're finishing a study now delivering Qigong to cancer caregivers. And cancer caregivers often are under more stress than the patients. They have to hold it all together, do emotional care, lifting, doing skills they weren't trained to do while they keep the house clean or maintain a job. So there's a lot of stress there, but they don't have the luxury of going to classes twice a week. So we have a randomized trial exposing caregivers to either a community-based class, a virtual class where they have recorded sessions plus one-on-one sessions at various times during the 12 weeks, to an online self-paced educational control group where they're doing reading and then they speak with one of our staff to see if they have any questions and just to do some psychosocial support. We don't have the data yet, but the question is, do they learn well? And we have ways of, we film them at baseline, in the middle, and at the end, doing the protocols, doing the movement. And so we want to know, have they learned well? And we would think that people who learn well are going to have better clinical effects. Surprisingly, that's one of the things that people haven't studied yet. We've also converted some of our COPD studies, which are Tai Chi based, and people enjoy it. There's some advantages, particularly for people with morbidities. It's really hard to schlep to the hospital or to some center a couple days a week, and particularly in bad weather. We have to adapt how we teach and what we teach, but typically in the protocols that we do, we teach simple things so people can really feel the principles and not get caught up in complex sequences to remember. But I think the data is coming in pretty quickly, and NCCIH have specific mechanisms around pure virtual delivery of mind-body practices. And so I'd say in a few years, we'll know what works, what doesn't work, and for which populations.
Thanks.
And the dosing piece, dosing piece, that's tricky. Again, we don't know. It's actually a really deep question, because what is a dose? We know what a dose of an aspirin is, in terms of milligrams, the active ingredient. But there's so many active ingredients in Tai Chi. Which ingredient are you dosing? So the most obvious way to look at it is, like, do they go to 1 class a week or 2 classes a week? Do they go for an hour or 2 hours? But just like people in this lecture that are here for the same amount of time, some people are checking their phones, some people are thinking about other things, some people are multitasking. In a yoga class, some people are really there and some people aren't. So we don't know what a dose is, but by and large, most of the studies out there that I shared today are at a minimum 12 weeks. Some of them went as long as a year, most 6 months, many 6 months. Most of them practice once or twice a week with a teacher, and then they're encouraged to do a little practice at home. So something like that is likely to result in some clinically meaningful change.
And while we're waiting for the virtual research to be done, do you have recommendations? Because as far as I know right now, Tai Chi is not covered by, for example, Medicare. I don't know if there's any movement in that area, but are there any good resources, sort of like a national association or something, in terms of if we wanted to refer elder people or patients to find reputable Tai Chi teachers? Do you have any recommendations for that?
Not really, partly for a couple reasons. I'm not allowed to endorse one group over another. I think NCCIH has some information on their website and maybe a
Okay.
little clip of what Tai Chi is like, but I would just look around. Who's doing, there's a lot of resources online. There are YouTubes, there are, DVD sets you can buy. There are online courses now. But I think a lot of it is just like finding a good primary care doc or a good psychologist or psychiatrist to work with. It's person dependent. What works for one person doesn't for the other. So I think there are opportunities out there to try different things. And I think the risk is low and the costs are low to just try out a class. And especially if you're not traveling and it's virtual.
Right.
But there is something nice about being together. So I'm
Yeah.
not saying that we should just go virtual. There's something about being together and the touch that happens in classes when it's appropriate in terms of COVID and things like that. The haptic learning that happens, the interactive stuff, those are really important parts of the training.
A few questions came up, and maybe this will be the last one that we'll do, but thoughts on comparisons between the outcomes of yoga versus Tai Chi in the areas you've mentioned, and then also, distinctions between Qigong and Tai Chi. So kind of a comparative, and then we'll leave that complex question as your last.
Yeah, that's pretty straightforward. So there are very few, I think there's one now, but very few back-to-back comparisons between Tai Chi and yoga. And then you go, which yoga, which Tai Chi, which teachers. I think, we need a lot of data for this. This is what I think. I think there's great data on pain and psychological behavioral pieces with yoga, metabolic things, blood pressure, things related to metabolic disorders, and Tai Chi as well. I think one of the places that they distinguish is in balance. I think a lot of Tai Chi was really designed as a martial art, so you're usually standing, could do adaptive seated, but you're really doing functional things, lifting, pushing, pulling. Whereas in yoga, downward dog is not a really practical real world position to be in, or the corpse pose. So I think in terms of balance, the evidence is much stronger. And if we were to do back-to-back comparisons, that piece would be there. In terms of cognition, I don't know. I think they both engage a lot of cognitive motor skills. We'll have to see. There's a little bit of growing evidence that yoga can affect cognition. In terms of this question of Qigong and Tai Chi, that is a little philosophical and everyone has their own answer. So the word Qi has a lot of different meanings. It's like snow and Eskimo. There are a lot of different types of snow. Qi, as in Qigong, I define it as sort of the information that shapes biological or processes in nature. So like morphogenesis, something knows to make a fingernail at the end of a finger and not a nostril. And that information is what shapes biology. That's one definition of Qi, information. Some people talk about vital energy. Tai Chi is yin and yang, and it's a philosophy. And Tai Chi Chuan, that we've been talking about, is boxing or movement, manifesting those principles. So they're different kinds of Qi. In that sense, Qigong, Gong means mastery. So Qigong is having skill or mastery over this information or your vital energy. I think of Tai Chi as a form of Qigong. It's about that. And both are typically, not always, but typically based on yin and yang theories. So I see that Tai Chi is a form of Qigong. Some Qigong is about interacting with the world and boxing and physicality. Some is much more spiritual and meditative. But I see Tai Chi, especially the way we're teaching it, as a form of Qigong.
Well, thank you. We're at the hour. Really always such a joy to learn from you. And for everybody who's on, I think about a month from now, we're going to have another one of Dr. Wayne and my colleagues, Dr. Iman Majd, who is the interim director at the University of Washington Osher Center. And he will be talking about related, traditional Chinese medicine. So really expanding on these whole systems and how they can benefit our health. So thank you. You're getting some thank yous in the chat. Great presentation. This will be available recorded for sharing for if you know others who would be interested. And also just to note, the Osher Center at Northwestern has fitness and wellness classes, including Tai Chi. I'm actually not sure if they are happening right now in the virtual setting, but in the past we have offered a whole range of wonderful classes, including Tai Chi. And you can see those on the NM website. So with that, again, Dr. Rain, have a wonderful rest of your day. Thank you for sharing your knowledge with us, and happy holidays.
Same to you, Mel, and thank you for the invitation. Really enjoyed it.
Yeah. Bye. Bye, everyone.